Hello everyone, welcome to a new session in the series of medical education, that is 1 minute preceptor model. Myself Dr. Tejinder Singh, MD Community Medicine. So let's begin our session. Our specific learning objectives are to understand in brief about the 1 minute preceptor model and its application, and what are the 5 micro skills that are required for OMP model. So problem क्या रहती है bedside teaching में? There are lack of clear objectives, they are focused mainly on recall, and sometimes we teach inappropriate to learners' need, and we dominate over the case, we take over the case, and we teach the student by humiliation. Now 1 minute preceptor model, it is based on the premises that कि last 1 minute में real teaching takes place. Real teaching कब होगी? Last 1 minute में होगी. It takes lesser time and it is best suited for places with high workload. Now what are the 5 micro skills that are required for OMP model? That is, we have to get a commitment, get a diagnosis, we have to look for supporting evidences, that is reason behind the diagnosis, we have to reinforce to the student what is right, what is wrong, and we have to correct mistakes so that they are not repeated again, and we have to teach the general rules so that they can apply to another cases. Now first is get a commitment. We have to gauge the level of student knowledge and understanding, and as a teacher we should not offer any interpretation or explanation at this stage, and we should allow the student to use his or her mental faculties to reason out. And by asking them to commit a diagnosis, we are actually helping them to activate and use her prior knowledge. Now we have to look for supporting evidences. Once the diagnosis is made by the student, we have to defend the diagnosis by way of reasoning. Now here we need to encourage the student to articulate the reasons. Now reinforce what was right. Sometimes क्या होता है, student एक guesswork करते हैं to determine the right diagnosis. So we should reinforce the point so that they develop a mental association between clinical picture and the diagnosis that they have guessed. Now reinforcing them, it is a right way to ensure that such behaviors are repeated in the future. कि जो positive behaviors हैं, essential behavior है, वो repeat हुए future में. Now fourth is we have to correct the mistakes. Mistakes क्या होती है, repeat होती है कई बार, so we have to correct the mistakes. It can be error in judgment or act of omissions. So mistakes can be due to error in judgment and act of omission. And rather than humiliating the student, हमें student को humiliate नहीं करना है when a mistake is made. It is good idea to first let the student think कि क्या mistake उन्होंने की है, और then we have to correct that mistake. लास्ट इज टू टीच द जनरल रूल्स. सो टिपिकल पेशेंट क्या होते हैं, कई बार अवेलेबल नहीं होते क्लिनिकल प्रैक्टिस में, हाई वर्कलोड होता है. सो स्टूडेंट को he should be able to apply the knowledge what she have learned during one case presentation to another situations also. So general rules are remembered better than very specific rules, and we should not give any unsupported personal opinions in this stage. My references for this slide are Principle of Medical Education, 5th edition by Dr. Tejinder Singh. Thank you everyone. Like, share and subscribe.